Hi, I am Karyn Georgilis, and I, like you mentioned, am a design researcher and strategist at Continuum. It's a global design and innovation firm, and I'm out of their Boston office. Before that, I spent some time working in Mayo's Center for Innovation, a couple medical device groups, but in my current role, I consult for a whole slew of different healthcare organizations, and while they're all coming to Continuum with different needs and different concerns, a commonality among them that if you're in this room and listen to Sean's talk, you're aware of, they're all trying to integrate design thinking, human-centered design, or start their own internal innovation team. And this isn't new. This has been going on for quite some time. But when it was new, we thought the majority of these teams were struggling. Now that a decade or so has passed, arguably the only thing that's changed is now we know the majority of these teams are struggling. Because if we're honest, most of the ideas and the projects that come out of these teams end up here. And so the natural next question is, well, then why? And that blame often falls on the same place. It almost always falls on the institution, that the institution is too big, it's too slow, our team doesn't have the funding, our team doesn't have the talent. And I don't want to say that those things aren't true, because they can be. But I have a fear that we spend so much time focusing on the flaws of the institution that we don't pause for like a hot sec to actually think about the flaws of the initiatives themselves. I'll give you an analogy. Has anyone ever tried to make sourdough? Did it go well? Probably not, because the majority of novice bakers often try to make sourdough right off the bat, and they expect this picturesque, bubbly loaf of bread first go. But that's not how sourdough is made, because the first step is actually to find a starter. And these sourdough starters, they're small fermented pieces of dough, and you can really only get them from an experienced baker. And the reason you want them is they're what you take, integrate into your own ingredients, and that's what will make your sourdough rise and get that bubbly, picturesque loaf of bread. And the same is true with starting internal innovation teams, because history proves that starting from scratch doesn't work. So what's the equivalent to a starter? What are on-ramps you can take to integrate practices from groups already succeeding? And I don't bring this up to be a bummer. I bring this up because in my current role, I work with institution after institution who ends up abandoning a process that can truly help patients simply because they started too big too soon. And if you are in a position to partner with a professional design firm, great, because I know a pretty good one. But if not, before you dive into a massive innovation project, I encourage you to pause and try one of these bite-sized option firsts. Partnering with a nonprofit consultancy, Design for America, or a design school-sponsored studio. The first, nonprofit design consultancies. They are organizations that use the design process to help other nonprofits. Great example is Design Impact. It's Ohio-based, recently worked with Cincinnati Children's Hospital, who's ranked as one of the nation's top children's hospitals, but also headquartered in a neighborhood with one of the nation's highest rates of early childhood health issues. So they brought in Design Impact, who knew that traditional forms of community engagement weren't going to go deep enough for this project. So they asked parents, a group traditionally just seen as research subjects, to actually help execute the work as peer researchers. So from there, Design Impact worked with the parents, hospital representatives, and went through the design process centered around community health engagement. And the result is a concept that they got to co-create. It's called the Learning Caravan and Creamery, which is first and foremostly an ice cream truck, but also serves as a traveling touch point for crucial community health information, and it's a concept they're prototyping now in the hospital. Another option you can pursue is DFA. And Design for America is a national organization that pairs university chapters, and these university chapters are made up of design students, business students, and engineering students, with local organizations trying to solve complex issues. So these qualified students get their hands on real problems, the local organizations get to dip their toes into design thinking. Their most impressive and profitable case study to date is when they partnered with North Shore University Hospital in Chicago, who at the time was trying to reduce patient infections acquired during hospital stays. So they brought on DFA to tackle the problem and walk them through the fundamentals of design thinking. The result? After rounds of in-hospital ethnographic research, collaborative ideation, and prototyping, SwipeSense was born. And SwipeSense is a system that uses sensors in personal badges as well as sensors in dispensers to capture hygiene data without interrupting employee workflow. And it's important to note that this concept has gone far beyond sticky notes. This has spun off into a successful startup based in Chicago. I encourage you to look it up. And now if you're looking for a slightly more established option than DFA, you can pursue a design school that offers sponsored studios to outside organizations. So these outside organizations act as clients, they bring a problem to the university, and then the university offers students a cross-disciplinary course where they use the design process and walk the client through along the way. The most robust example of this is the University of Cincinnati's Live Well Collaborative, who consistently partners with heavy hitters like Pfizer, Hillrom, and United Healthcare. And when one of their most recent clients, UC Health, needed to transform their bone marrow transplant center, they approached LiveWell as an affordable, approachable option to introduce design to an organization relatively unfamiliar with it. So teachers and professors worked with UC Health to interview patients, identify opportunity areas, and then go beyond concepting by creating a detailed vision and design of that future transplant center. All skills and resources UC couldn't layer on top of their clinical knowledge without the Live Well Collaborative. Okay, so what? Those are all interesting ideas and exciting case studies, but why should you actually do these things? Because I think it's really easy to look at all three of these and consider them junior. But I would also argue that the things that make them seem the most junior are also what actually makes them useful and worth trying. Because consider a lot of the common gripes of new innovation teams that, well, we don't have enough money. These are extremely affordable options. The universities might even pay you. If you're worried you don't have the talent, then it makes a lot of sense to work with an organization that has the newest, most emerging talent. And if you complain that your institution is too big, it might actually be useful to partner with someone who's advantageously naive and can still think beyond the barriers that you see every day. So all of that to say, before your organization dives headfirst into a massive innovation project, or you wake up tomorrow and decide you're also going to have an internal innovation team, first, get excited that you're going to try something you might not know how to do. But then pause and consider partnering with someone who can help you start.
Thank you very much. Karyn, thanks so much. I need to know more about the ice cream truck.
Oh.
Are we putting ice cream trucks into hospitals? That's what I was on.
I think that's phase 2, but they're still working out there.
I want to go there, so thank you for that. When you talk about basically biting too much of the apple at once, you're trying something too big. I get why, if you're trying to do this big thing and there's only 2 people, why that's a mistake. But aside from just the staffing, what's the biggest mistake in the mindset that you see as to why it's a bad idea to try to start too big?
I think it's because, the whole idea behind design thinking, a core tenet is prototyping, and while we approach that to individual products and services, sometimes groups that are new to it don't apply it to themselves. And if you think of yourself as a prototype, you're not gonna, you skip that MVP stage, you're not gonna go straight to the consumer-ready model right off the bat, and that's what building a team tomorrow is. You're starting the consumer-ready model off the bat instead of prototyping along the way.
Very good. Thank you very much. Karyn Georgilis, thank you very much.